Welcome, dear students. Myself, Dr. D. Raksuda, Assistant Professor, Department of Chemistry, St. Joseph's College for Women, Autonomous, Vishakhapatnam, Andhra Pradesh, India. I will be dealing with the Module 3, Chapter 3.5 Antimalarials. Learning outcomes. At the end of the chapter, you will become aware of the various stages in the life cycle of the malarial parasite. You will be able to classify antimalarial drugs based on chemical structure. You will be able to summarize the structure, properties, intrinsic activity, and dosage forms of different categories of antimalarial drugs. You will be able to identify the most effective drug for every species of Plasmodium. The contents: introduction, types of Plasmodia, life cycle of the malarial parasite, and chemical classification of antimalarials. So, firstly, antimalarials are the chemotherapeutic agents which are used for the prevention and cure of malaria. Malaria is a disease which is caused by the Plasmodium parasite. So, where this word malaria is being coined out? It is being coined from an Italian phrase mal area, meaning bad air. Mal means bad and area means air. It is clinically characterized by periodic fever, anemia, enlargement of liver and spleen. Malaria is a highly widespread infectious disease which is caused by the parasitic protozoa or sporozoa of the genus Plasmodium. At a certain period of time, it is the cause of high sickness in tropical and subtropical countries like Asia, Africa, and South America. Billions of people were affected with malaria and millions have died annually. Due to cooperation of the countries and WHO, the disease could be in control for the past 25 years. Nearly 50% of the malaria cases which are recorded all over the world are because of the Plasmodium falciparum. Types of Plasmodia. There are four major types of Plasmodia which infect human. Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. Plasmodium vivax causes benign tertian malaria. It is mild, but it has a tendency to relapse. Plasmodium falciparum causes malignant tertian malaria, which, if not treated properly, may result in death. But the disease, once cured, has no tendency to relapse. It is a fulminating infection. In both the cases, it was observed that every third day there develops a fever with rigor. Hence, the term tertian is being used. Plasmodium ovale and Plasmodium malariae are mild. The individual develops fever every fourth day. Hence, they are described as benign quartan. Life cycle of the malarial parasite. In order to understand the action of antimalarials, it is necessary to know the parasite life cycle. An individual is being affected by malarial parasite through the bite of female Anopheles mosquito. It can also be the individual can also be affected by blood transfusion or through blood transfusion or from the mother to the fetus through placenta. After the entry, the sporozoites develop through three stages: erythrocytic stage, and development of sexual forms. In the stage 1, that is in the pre-erythrocytic stage, sporozoites disappear rapidly from circulation and invade the hepatic cells. The duration of pre-erythrocytic stage, it varies with the species of the Plasmodium. It will be 5 to 7 days for Plasmodium falciparum and 8 days to several months in case of Plasmodium vivax. The host does not develop any symptoms during this phase. After the completion of this phase, The infected tissue schizont gets ruptured and releases several thousands of merozoites into the bloodstream. Merozoites invade the erythrocytes and undergo further development of multiplication, giving rise to erythrocytic schizont and asexual erythrocytic form, which can be also called as symptomatic cycle. The infected RBC ruptures and releases thousands of merozoites into blood. It is associated with fever and rigor. The merozoites thus released are going to invade the fresh erythrocytes and the erythrocytic schizons repeat. Development of sexual form and development of the male and the female gametes occurs in this stage. During the mosquito bite, they are sucked from the blood and mature into gametes in the mosquito gut. The zygote invades the gut wall to form oocyst. It contains thousands of sporozoites. After about 1 to 4 weeks, depending upon the species of Plasmodium, the oocyst ruptures, releasing free sporozoites which reach the salivary glands of the mosquito and are ready to injected into the host. This is all about the life cycle of the malarial parasite. Chemical classification. Cinchona alkaloids, quinoline derivatives, phenanthrene methanol, antifolates, artemisinin compounds, antimicrobials. Cinchona alkaloids, quinine and quinidine. Quinoline derivatives 4 amino quinolines, chloroquine, amodiaquine, 8 amino quinolines, primaquine, tefnoquine, bulaquine, quinoline methanol, mefloquine. Phenanthrene methanol, halofantrin. Antifolates are subcategorized into bigonides, proguanil, diaminopyrimidines, pyrimethamine, sulfonamide, sulfadoxine. Artemisinin compounds are artesunate and artemether. Antimicrobials, doxycycline and etoquone. Cinchona alkaloids. Cinchona alkaloids, the best examples are quinine and quinidine. Quinidine is an optical isomer of quinine. The molecular formula is C20H24 N2O2. It consists of a quinoline nucleus and Q-nucleidine system. Both of these are attached by means of a carbon containing a secondary alcohol. Oxomethoxy group is attached to the quinoline nucleus. A vinyl group is attached to the Q-nucleidine system. The quinine occurs as a white, odorless, slightly efflorescent material. It is intensively bitter in taste, less soluble in water. It must be preserved in well closed and light resistant containers. Antimalarial action. Cinchona alkaloids are highly active blood schizonticides. They are going to suppress the asexual reproductive cycle of the malarial parasite, that is the stage 2. And they do not show any effect on sporozoites, that is the stage 1 pre-erythrocytic stage. There is no effect of this drug quinine. Preparations and doses. It is prepared in the form of quinine sulfate tablet or quinine hydrochloride tablet. The dosage of these is 300 mg. If the patient was unable to swallow, in that case, it can be administered through intravenous or intramuscular injection of quinine sulfate. The dosage is 300 milligrams per milliliter. Quinoline derivatives 4 amino quinolines, chloroquine, amidoquine, 8 amino quinolines, primaquine, tefnoquine, and bulaquine, quinoline methanol, mefloquine. 4 amino quinolines. Chloroquine. The molecular formula is C18H26N3Cl. The chemical name is 7-chloro 4 4-diethyl amino 1-methyl butyl amino quinoline. It occurs as a white or slight yellow odorless crystalline powder. It is bitter in taste, slightly soluble in water. It must be preserved in well closed, light resistant container. Antimalarial action. It acts as a suppressive and it is superior to quinine. It kills the erythrocytic forms of Plasmodium vivax and Plasmodium falciparum. It is effective against the gametocytes of Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. It doesn't show any effect on sporozoites, the pre-erythrocytic stage. Preparations and doses. It is prepared in the form of chloroquine phosphate or sulfate, which is being administered orally. The dosage is 250 milligrams. In case of chloroquine sulfate or phosphate injection, the dosage is 40 milligrams per milliliter. Imodiaquine, the molecular formula is C20H22N3ClO. The chemical name is 4,7-chloro 4-quinolyl amino 2-diethyl amino methyl phenol. It occurs as an yellow, odorless crystalline powder, bitter in taste. It is soluble in water. It must be preserved in well closed, light resistant containers. Antimalarial action. It is almost similar to chloroquine, but Plasmodium falciparum strains which are resistant to chloroquine may be sensitive to imodiaquine. Preparations and doses. It is generally administered orally in the form of imodiaquine hydrochloride. The dosage is 200 milligrams. 8 aminoquinolines. The examples are primaquine, tefnoquine, and bulaquine. Primaquine. Primaquine, the molecular formula is C15H21N3O. The name is 6-methoxyquinoline 8-yl 1,4-diamine. It occurs as an orange red crystalline powder. It is usually bitter in taste, soluble in water. It is preserved in well closed and rite resistant containers. Antimalarial action. It has the ability to kill the pre-erythrocytic stages of Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale. It is effective against gametocytes of all species of human malarial parasites. Preparations and doses. Primaquine phosphate tablet. The dosage is 7.5 mg. It is administered orally. Bulaquin, the molecular formula is C21H27N3O3. The chemical name of the compound is N4,6-methoxy 8-quinolinyl amino pentyl octanamide. Tefnoquine. Tefnoquine is C24H28F3N3O3. The chemical name of the compound is 2,6-dimethoxy 4-methyl 5,3-trifluoromethyl phenoxy quinoline 8-yl pentane 1,4-diamine. Tefnoquine and bulaquine are analogues of primaquine. Tefnoquine is a new drug which is going to be cure the disease rapidly. Quinoline methanol. Mefloquine. The molecular formula is C17H16F6N2O. The chemical name is 28-bis trifluoromethyl. Quinoline 4-yl piperidine 2-yl methanol. It is a white or slightly yellow crystalline powder, usually bitter in taste, very slightly soluble in water. It is preserved in well closed and light resistant containers. Antimalarial action. It acts on the erythrocytic stage, highly effective against Plasmodium falciparum. Preparations and doses. Mefloquine tablet 250 mg and 750 mg. Phenanthrene methanol, halofantrin and lumifantrin. Here are the structures of halofantrin and lumifantrin. Halofantrin C26H30Cl2F3NO. The chemical name is 3-dibutyl amino 1,13-dichloro 6-trifluoro methyl phenanthrene 9-aryl propane 1-ol. The properties are it's a white crystalline powder, bitter in taste, soluble in water. It must be preserved in well closed and light resistant containers. Antimalarial action, it acts on the erythrocytic schizontide. It is highly effective against Plasmodium falciparum, also effective against strains resistant to chloroquine, pyrimethamine, and quinine. Preparations and doses, halofantrin tablet, it must be administered orally. The dosage is 500 mg. Antifolates. Antifolates are subcategorized into three types: bigonides, proguanyl, diaminopyrimidines, pyrimethamine, sulfonamide, sulfadoxine. Bigonides, proguanyl C11H16 and 5Cl, 1 amino, 4 chloroanilino, methylidine, 2 propane, 2 aryl guanidine. The properties are white crystalline powder, bitter in taste, sparingly soluble in water. It is preserved in well closed and light resistant containers. Antimalarial action is an effective schizontide against both Plasmodium vivax and Plasmodium falciparum. Prevents the development of gametes encysted in the gut wall of mosquito. Preparations and doses. Proguanyl hydrochloride tablet 100 mg. It must be administered orally. Diaminopyrimidines, pyrimethamine. Pyrimethamine, the molecular formula is C12H13 and 4Cl. The chemical name is 5,4-chlorophenyl 6-ethyl 2,4-pyrimidine diamine. The properties are white crystalline powder, tasteless, insoluble in water. It must be stored in tightly closed, light resistant containers. Antimalarial action, effective for the suppression of Plasmodium falciparum and sometimes for Plasmodium vivax. Preparations and doses. Pyrimethamine 25 milligrams. Sulfonamide sulfadoxine. Sulfadoxine molecular formula is C12H14 and 4O4S. The chemical name is 4-amino and 5,6-dimethoxy 4-pyrimidinyl benzene sulfonamide. Properties, it's a white crystalline powder, slightly bitter in taste, soluble in water, stored in tightly closed light resistant containers. Antimalarial action, it is effective against the asexual blood forms of parasite. Preparations and doses, diamylo diphenyl sulfane. It is administered orally. The dosage is 25 milligrams. Artemisinin compounds, artesunate and artemether. Their IUPAC names are little large because the structures are complex. The molecular formula of artemether is C16H26O5. The properties, artesunate is very slightly soluble in water. Artemether is lipid soluble. It is completely insoluble in water. Antimalarial action, they are effective against the schizonticides against all the malarial parasites, including those resistant to chloroquine and quinine. There is no effect on the hepatic states. Preparations and doses. They can be administered orally or through injection. Artesunate tablet 50 mg or artesunate injection 60 mg. Artemether injection 80 mg. Antimicrobials, doxycycline and etowaquone. Doxycycline, the molecular formula is C22H24N2O8H2O. The chemical name is 4S, 4AR, 5S, 5AR, 6R, 12AR, 4 dimethyl amino, 1, 5, 10, 11, 12 pentahydroxy, 6 methyl 312 dioxo, tetrahydro, 4H tetracene 2 carboxamide. Properties: it is a light yellow crystalline powder, bitter in taste, soluble in water. It must be stored in tightly closed, light resistant containers. Antimalarial action: it is potent against the blood schizones and the primary erythrocytic forms of Plasmodium falciparum, including those which are resistant to falciparum. Preparations and doses: dioxycycline tablet 50 to 100 mg. Etavoquone C22H19ClO3. The chemical name is 3,4,4-chlorophenyl cyclohexyl 4-hydroxy naphthalene 1,2-dione. It is a white crystalline powder, usually bitter in taste, soluble in water. It is stored in tightly closed, light resistant containers. Antimalarial action: it acts by selectively interfering with mitochondrial electron transport. Preparations and doses: Etavoquone tablet 250 mg. It must be administered orally. So, what we have learned? In a nutshell, we have learned that malaria is caused by various species of protozoan Plasmodium. Antimalarial drugs can be segregated into different classes based on chemical structure, along with the structural details, properties, efficacy, and dosage forms of various classes of antimalarial drugs. Hope you all understood. Thank you.